All right, I see that our meeting is now streaming live on YouTube. So I want to welcome everybody. Thank you for being here and call to order the City of Charleston Health and Wellness Advisory Committee meeting for Wednesday, December 6, 2023. I know it's a busy time. I hope everybody had a great Thanksgiving. I know it's a busy time for a lot of us as we prepare for the holidays and try to get everything done for year end and wrap up everything. So I very much appreciate your time. I know how valuable your time is, and it's very valuable to us here at the City of Charleston. So thank you for spending a little bit of time with us this morning. And we've got a special treat this morning. We have Jonathan Kessler, who is the Suicide Prevention and Community Engagement Partnership Coordinator at the Ralph H. Johnson VA Medical Center here in Charleston. And we're going to start off our meeting by asking Jonathan to give us a little bit of update on suicide prevention and community engagement, if you would. So.
Okay, I will take that as my cue. I'm going to get back to sharing the screen. One more time. I had it the first time. I should have just left it well enough alone.
All right, I see it now. I think we're good.
Okay, you do see it. I'm trying to see it so that I can actually advance the slides. Like I said, I'm not too savvy when it comes to Zoom. Okay. Are you able to see this slide that my arrow is on?
Yes.
Okay. All right. I'm going to go with that then. All right. Well, thank you so much. This is fantastic, and I greatly appreciate the invite. Paul, I think we connected at the Low Country Mental Health Conference. And I see that Mayor Tecklenburg is on. So he did a grand opening and a couple of musical numbers, which was greatly appreciated, and that's support for the community as well. So before we get started, suicide is a sensitive topic, and as much as we attempt to break down the stigma behind it, we still have a lot of work to do, but just acknowledging the fact that it is a sensitive topic. We know by statistics that, for one death by suicide, approximately 135 individuals are directly impacted. So I don't think it's too far of a stretch to suggest that the likelihood of each of us on this call has been affected in one way or another by a suicide. And so just keeping that in mind, if it gets difficult or it gets uncomfortable and you need to step away, that is completely supported and understood. For those of you that may not be aware, the National Lifeline is available. It's 988. And so that'll connect you directly with a mental health counselor that can help you at that time as well. So I'll go ahead and get started. So yes, I'm with the Ralph H. Johnson healthcare system here in Charleston. And where it's nice to be recognized as the only medical center in the state currently that is a top 5-star rated hospital in terms of patient experience and customer service. So it's a big honor to be part of this healthcare system. I've been there for about 20 years now and have been in this role going on about a year. So our position, I say our because you'll see Anne-Marie Mendez's name listed on the title slide. And we cover the Ralph H. Johnson catchment area, which goes all the way from Horry County, Myrtle Beach area, down through Hinesville in Georgia. So basically hugging the coastline. So between she and I, we cover all of our 15 counties. So it's a really large section of veteran population that we serve. So suicide, it is a national public health issue. And just want to point out that it clearly is not exclusive to veterans. It is a national public health issue. We also know that suicide is very complex. There's not one cause, but there's many factors that may contribute to someone thinking or actually taking action to end their life. Um, and so VA, there we have two main priorities, and one of those two, which really I would say at this point is number one, is intervening and working solidly to prevent veteran suicide. So that has come down from our Secretary of the VA, and this program in particular is using a public health approach to reach all our veterans, even those, or especially those that are not engaged in VA care. We know that those numbers are much higher than those that are engaged in the VA. And so we use a public health approach in order to be able to do this. One thing I would ask, since this is such a diverse and important audience for Charleston County, is, as I'm going through the material, if you might just consider what areas are you currently supporting, or what areas currently exist in which suicide in general is a focus, and to what extent perhaps can we help to support this as well. So this is really an opportunity as a call for action. So as we're going through these slides, if you're just thinking about what your agency or area is performing in terms of suicide in general for prevention, that would be very helpful. And then I'd like to leave more time than slide deck presentation to maybe have more of an active conversation. So high level data points here. So the data is always going to be about 2 years behind, and but a lot of these numbers are from 2020. The 2021 suicide prevention report just came out. You can find that report easily just by Googling it. And for the veteran component of that is available as well. That came out on the 16th of November. So those data points are still being drilled down. But this slide deck for this purpose is looking at 2020. So you can see the numbers here. Oftentimes you're gonna hear that the number 22 when it comes to veteran suicide. A lot of nonprofits utilize that number and so forth. At the end of the day, we really want to look at the rates per 100,000. It's more of an accurate number. At the end of the day, one death is too many. So I don't get into the finer points of number of deaths per day if somebody is promoting the 22 per day. The bottom line is it's being spoken about and it's being addressed. So just moving forward on that note, but as of 2020, approximately 17 veterans per day died by suicide. So again, getting back to all the esteemed individuals and departments that are present at this moment, Charleston County is the second highest veteran population within the state, second only to Richmond County, the Columbia area. So we have approximately 30,000 veterans that reside just alone in this county. It's maybe a few hundred more up in Richland. So this is why I'm very honored to be here and just very passionate about this topic, because there's a lot we can do to close the gap of veteran suicide and really suicide in general. So this gets back to the mantra that suicide is everyone's business. So collectively, this is how we're going to close that gap, by partnering and engaging the community and each other. So we're not residing in silos in our individual departments and organizations, but working together collectively. And so this is across the nation, our 5 territories as well, to be able to impact suicide and veterans in particular, the 20 million or so that have fought for our freedoms. So we use a public health strategy, and it's with the general premise and the research, and it's hope-filled that suicide indeed is preventable. We want to get that message out there as strongly as we possibly can. Also, it's important to point out it's not a mental health problem, but there's so many layers that make it very complex. But just because an individual is having thoughts of suicide, of killing themselves, it doesn't necessarily mean that it's a mental health problem. Not that that's an additional stigma we don't want to add to it. We want folks to get treatment and get help, and not label it so much, but it is very complex. And the other component I really want to point out is that my program, the Community Engagement Partnership coordination, is as a result of research that demonstrated that over 2/3 of the veterans that have died by suicide are not engaged in VA care, or if they hadn't been engaged in the last 2 years. That's a significant number of veterans. That's about 65%. And so we want to be able to reach the veterans in communities in which they reside, regardless of where it is that they choose to receive their care. This priority area slide, this goes hand in hand with the governor's challenges. And so all 50 states and 5 territories have adopted a governor's challenge. And so I had the honor to be able to attend the annual report presentation to our governor earlier this year. And so just want to touch a little bit in greater detail. So the 3 priorities, as you can read here, are to first and foremost identify service members, veterans, and their families, and then screen for suicide risk. So if you are in a program in which you're serving your population, do you have it built in which maybe you're screening to identify if they are indeed a veteran? And if so, what do you do with that information, and how can we help you further? And then if you're in a healthcare setting, mental health would be the same as a healthcare setting. Are you screening for suicide risk? The second priority area is promoting connectedness and improved care transitions. Promoting connectedness, we understand, is one of the biggest protective factors to be able to help folks feel less alone and more obviously connected, particularly as we're in the thick of the holiday season. Loneliness is a risk factor, and so we want our population to understand that we're here. There are programs or events, there's others that care and love them, and we just want to be able to get that message out. And then thirdly, increasing lethal means safety and safety planning. So we know with veterans in particular, firearm ownership is the majority of our veterans own a firearm. They're very familiar with firearms, and they're comfortable with firearms. The take home here is not to restrict someone from ownership, because that's an amendment right, but rather to be very mindful about keeping it safe and secure. We know with our veteran population, the lethality of a suicide by firearm is 95% over all other means, which may include strangulation and other ways of someone maybe contemplating ending their life. So the more that we can do to promote lethal means safety when it comes to firearm storage and keeping it secure, we have a greater impact in that way. Second to that, of course, would be opioids and other medications, whether accidental or intentional overdose. So we want to make sure that folks are aware, of that factor and also prepared. And then safety planning is simply having a document that typically is utilized in conjunction with a mental health professional or a provider that helps someone to list out what their strengths are, what their opportunities are, what to do when they begin to feel themselves in a non-well state of mind. And that can be a document in which they can turn to in times of crisis when things feel very black and dark and kind of hopeless, to help them to get out from that spiral. So the VA has developed an app that's free that can help assist the safety planning documents, so they have something to turn to in times of crisis, or even if they're beginning to feel like a little bit hopeless. So these 3 priority areas, if there's any work that y'all are currently doing that endorses these, we would love to be able to partner up and enhance those moving forward. And then if you're having thoughts of, well, I didn't really, consider this, but that sounds like a great opportunity, would love to be able to partner up and see what we can do to help support and promote that as well. This slide basically demonstrates that, we have to target this from a national level, from a state level, with the governor's challenge, but the real work comes down to boots on the ground in the communities. communities know what is available and what the gaps are and where veteran populations reside. I live in West Ashley. I feel fairly confident. I know what my community has and what it doesn't have. But I may be up in Horry County working with a population and a group up there. I'm not familiar, so I'm going to turn to the groups similar to this and ask them, what is it that your community is currently doing? What are the gaps? How can I help support you? And then ultimately, the community owns those interventions and those opportunities. So the suicide prevention team, we as the CEPCs, which is much easier to say than community engagement partnership coordinator, time and again, we fall right with the suicide prevention coordinators. They're the clinical side of the house. So both Anne Marie and I both have social work backgrounds, and we are clinicians, but our work again is with the communities and community partners, as opposed to one-on-one with the veterans. So our suicide prevention coordinators, they're the ones that actually do that work directly. There's over 450 prevention team members across the country in our 5 territories doing this work. My role, again, came about in about 2018 or so. We now have all VA medical centers have at least one community engagement or partnership coordinator. More oftentimes it's 2. And so we serve as public health, the public health approach to be able to really impact the community work that is currently being done and that can also further be done. And I think the main thing here is that, we're really wanting this to be a call to action, and because we know that suicide is all our businesses. And so whatever we can do to help impact that in a positive factor, we're going to really make this work. And so our role is to help collaborate, and we want to collaborate. And we also want to be able to help build coalitions that are interested in moving this forward. This is a kind of a general overview, but our short-term objectives, I've highlighted a few of them here, but it's obviously to engage our veteran population, regardless of where they choose to get their care, but where they are in the community, not asking them to come to us, but the community to rally around them, and in doing so to reduce these gaps. Intermediate objectives, you're going to hear this, you've heard this theme time and again as I've been speaking, but it's really to enhance community collaboration. And we spoke about firearms and also willingness to discuss those things in a non-threatening manner, but just we want to make sure that they're secured. And ultimately, the goal is to reduce veteran suicide deaths and attempts. So the last slide that I have of the presentation is so for the general population, it's a lifeline, 988. For veteran population, it's 988, then press 1. We call that the veteran crisis line. It's been about a year and a half now that number has been implemented. Previously, it was a 10-digit number, which was a bit difficult to recall in a moment of crisis. And so nationally, it was determined that 988 would be the number. We still have a lot of work to do to promote this and get the word out. Surprisingly, it's not as well known as we would have thought, although the call volume has increased tremendously when it came about in January of 2021. So with that, I'd like to have open dialogue, if I have time, that is, Paul, just to inquire again about. I'm sorry.
Any questions?
Any questions?
Comments? Mayor Tecklenburg, thanks for joining us.
Well, yeah, I'm so glad to be with you. Thank you, Mr. Chairman. I'm getting an echo on my.
Paul, I'm hearing that echo as well.
Yeah.
If everybody that's not speaking maybe could mute, that might help. Yeah, I think they did it. Thank you.
Is that better? Can you hear me?
Yes, sir. I can hear you, and there's no echo now, so that's great.
Oh, great. So, Jonathan, thank you for that. If I may, a couple of questions first.
Yes, sir.
The statistics, you mentioned the rate of 31.7 per 100,000. how does that compare to the population in general, number one? And number two, do you have local rates? Is it the same in the Charleston or Tri-County area as it is nationally, or any difference?
The rates of suicide per 100,000 for the veteran population is significantly higher than the general population. Um, and we understand, and this is why the rates are important, as most will understand, because it's an apples to apples comparison. So our veteran population is obviously much less than the general population, but those numbers are incredibly much higher. The state of South Carolina is slightly greater than the veteran suicide rate for the rest of the country.
So you have a number on that?
I want to give you the most accurate, updated numbers. And so I'm more than happy to reach out directly, or I can reach through Paul and I'll get those numbers to you. Yes, sir.
Okay. But what was it you said South Carolina is comparable to the veterans rate?
It's slightly higher.
Slightly higher. Okay. And but the veteran rate is much higher than the population at large, you're saying?
Yes, that is correct.
Okay. So and do y'all count overdoses, drug overdoses, if
yes,
there's
sir,
not?
Yes,
even when there's, I'm sorry,
I'm talking over you. I didn't mean to do that. So yes, that is correct. We also count drug overdoses as well. We work with the coroner's offices, and we actually have a metric, internal metric, in which we track those as well. So within the VA system, and I believe this is why the numbers are less of veteran suicide for those that receive their care within the VA. There are so many internal processes and things of that nature that we track on a daily basis among our suicide prevention coordinators, to really target the high-risk populations and the threats that will impact a person's livelihood and well-being. And so the opioid epidemic certainly isn't isolated to to veterans. It's everyone, but we do track those as well. And we actually have a public service announcement that we produce locally on our website that features one of our pharmacists talking about safe medication storage and awareness. So yes, that's absolutely something that we identify as well and track.
Thank you. So I guess one last question, and then maybe it's a discussion for whoever. I must admit to you, I'm not aware of other suicide prevention programs or systems, as you mentioned in your presentation on community engagement. So I'm just curious if and probably Katie knows, Dr. Richardson or others on the call, what else do we have out there in terms of suicide prevention in the local, in the Charleston region, and how can we connect those resources with you to be more effective?
Absolutely. One of the main tasks of our job is to help build coalitions within communities. So getting like-minded individuals, groups, and agencies to the table, and have a fair representation of our population, so that we're being diverse and having that inclusion as well, so that we're not leaving anyone behind and from the table itself. With that being said, there are a number of nonprofits that do excellent work. And so whether it's Warrior Surf or it's an equine therapy program or so forth, a lot of that work may not be directly related to suicide prevention, but it enhances connectedness. And in doing so, that's a protective factor. And so, we like to bring those groups to the table, and then, ensure that veterans and family members are aware that this is out there, and so they can, help them get engaged. It's not so much, if somebody has an aversion to water, that's fine. It's one medium, but maybe they have an affinity for horses, or maybe they have affinity for some other exercise, or what have you. We would like to connect them to that. What would be great is to have a roundtable discussion in the near future to look directly at this. Part of my role is to identify what's already in the community and do a landscape analysis, and then identify where those gaps exist and what we can do to close in those gaps to the population. I'll just give you one example. We recently had and I would call it a coalition. It was a fairly simple idea, and it's not it's not unique, but it's very effective. And that's a coffee and camaraderie. There's a veteran-owned coffee shop up in Berkeley County, and there was a nonprofit that basically funded the coffee for the day, and it was monthly, and it was for active duty military from Joint Base. It was for veterans, their families, and also first responders, many of which are veterans themselves. And it was an opportunity just to come together in a non-threatening manner and meet and talk about whatever, but also just having that connectedness and not feeling so alone. And relationships develop as a result of that simple act of coming together. And it was very well received. It would be wonderful to see that expand. That's just one idea. September is Suicide Prevention Month. The American Foundation of Suicide Prevention is very active in the community as well. And I was able to table and attend their walk that was done in North Charleston. And it really is about destigmatizing suicide. We need to talk about it. We need to do this also in our schools. We have a lot of children of veterans in our school system. Unfortunately, suicide, even though the rates may be higher for the 20 to, I think it's 40, I don't want to give you the wrong information, but our children also take their lives by suicide. And so when I met with someone in Berkeley County from their county office, they just had a suicide of a middle school student that day. So we want to get the word out there. We want to work upstream to this issue and not be reactionary to it.
Well, thank you very much. And if there's any way this committee could help convene the community partners, we'd be happy to help in any way. Thank you, Jonathan.
Absolutely. For those that I don't know if I'm still, the slide deck, I don't know if that is going to be sent out there, Paul, but it has my direct contact information on there, including my email address. And then the remainder of that very long PowerPoint, in case you were looking at the number of slides, it wasn't that I was going to go through each and every one. There's a lot of additional resources and what the VA provides for our heroes that have fought for our freedoms. So anyone on this call, and I know I'm running over, I apologize for that, but anyone on this call that would like to partner up and bring this discussion to the table to see what we can do to have the biggest impact on our community, I welcome that with open arms. That would be the biggest holiday present I could even imagine. Again, we have the second largest population of veterans in the county of Charleston. So I've been here 30 years, and I love and appreciate all the work that we do, and we can do just a little bit more to really make this impact.
Great.
So, again, for your time and attention. I can't express how grateful I am for this. And Paul, thank you for the invite.
And I will share the PowerPoint with everybody after the meeting.
Okay, thank you so much.
Very good. Well, thank you. Appreciate that. Some very important information, and was great to be able to get some of that information. And certainly, as Mayor Tecklenburg said, if this committee can do anything to help you, work with you, coordinate, groups, whatever, please reach out to us, and we'll be happy to help any way we can. So thank you.
Thank you.
All right, Kevin. And so, Kevin, Paul, I'm sorry.
Jennifer Brush.
Oh, yeah.
Hi, good morning. I have a question. Jonathan, are you all part of the statewide suicide coalition that meets in Columbia?
So they're we partner together. So that's the South Carolina Department of VA. So they've been in existence, as you likely know, for about 3 years now. So that's part of the governor's challenge in their coalition. I work very closely with their regional integration officer. She has a larger territory than I do, so we collaborate very often. In fact, we were scoping out a coffee shop just yesterday together to look to establish a coffee and camaraderie program. But yes, we work very closely together.
Okay, thank you.
Yes, absolutely.
Anyone else? Well, thank you again, Jonathan Kessler. Appreciate your time and all of this information. It was good to have this information with this committee. So thank you so much.
Very welcome. Do I disengage at this point, or
you're welcome to? No, you're welcome to join us. If you want,
to.
if you would like to continue, you're welcome to. But if you need to go, we certainly understand that as well. So, all right.
Thank you, Tim.
All right. We have next on our agenda. We have meeting minutes from our committee meeting on November 1st, 2023. Could I hear a motion to approve those minutes, please?
I make that motion.
All right, we have a motion to approve. Can I get a second?
I'll second.
All right, a motion to approve and a second. Any further discussion on those meeting minutes? All in favor to approve those minutes, please say aye. Aye.
Aye.
Any opposed? The meeting minutes have been approved. So we move on to our community health update, and I'm going to call on Dr. Katie Richardson from DHEC.
Thank you, Councilman Shealy. I want to start by discussing a day that we observed on Friday and celebrated at the Unitarian Church, and that is World AIDS Day. That is a observance that now has been going on for much of the 43 years that we have been in an HIV/AIDS epidemic. And it's really an opportunity for people worldwide to unite in the fight against HIV, show their support for people living with HIV, and remember those who have died. And we start thinking about the epidemic with really the number of people that don't even know that they are living with HIV. So the CDC estimates that about 16% of more than 20,000 South Carolinians living with HIV do not yet know their status. And those who don't know that they're living with HIV aren't able to get into treatment to help make sure that they continue to live healthy lives and also help to prevent the further spread of the infection. We did, in the Tri-County area, we did diagnose over 100 people last year. And I say we, that's not just DHEC, that's all across our healthcare entities. Diagnosed over 105 people with HIV, and a large portion of those, over a third, were young people, ages 20 to 29. So we know we have the tools to end the HIV epidemic. We're very grateful to Mayor Tecklenburg for signing on Charleston in 2019 as a fast-track city to end the HIV epidemic. We have those tools. We have prevention tools. PrEP is a medication that can be taken to prevent the spread of HIV. We have condoms. We have teaching young people about comprehensive sex education and consent. And then we have making sure that people know that they are living with HIV, if they are, that they are connected to care, that they remain in care, and then their viral load or the amount of virus in their body can be suppressed such that they are not able to transmit the virus to others. And so our event occurred again this year at the Unitarian Church. We appreciate Mayor Tecklenburg coming and talking about our Fast Track City goals, that we have done good work, but we have much work left to do. He talked about some of the data. When we look at the Tri-County area, to meet our 95, 95, 95 goals by 2030, 95% of Those living with HIV knowing their status, 95% of those connected to care, and 95% of those achieving viral suppression. We would need an additional 30% of our residents living with HIV linked to care, an additional 49% of our residents living with HIV who had been linked to care to be continued to be retained in care or continue to receive care, and an additional 36% of our residents living with HIV that have been linked and retained in care to achieve viral suppression. So a large part of that is addressing the stigma associated with HIV, which has continued throughout these 43 years. And that's really hopefully work that all of us can continue to do, because this is really has become a chronic disease. And those who know their status and are in care and taking their medications can continue to live a healthy, full life. So in addition to Mayor Tecklenburg joining us, we also had poetry, we had meditation, there was a dance performance, there was a candlelight walk in the garden, there was time for fellowship in Gage Hall to meet with organizations who address sexual health in our communities. The theme this year was nothing about us without us, and let communities lead. Really encouraging those who are at risk for HIV and those who are living with HIV. We really want to continue to elevate those voices to make sure that the programs and initiatives put in place are those informed by the population that we're trying to reach. So it did make the front page news in the Post and Courier on Saturday morning. And if you haven't seen that, please check it out. Paul is actually front and center in the photo of the candlelight walk in the garden. And we appreciate you coming as well, Paul. So World AIDS Day observance on December 1st. And then there was that was followed by a free testing day yesterday here at all DHEC health departments. But even though every day is not free testing day, we do always have low cost testing. And so we don't want anyone to not come in to be seen for testing based on ability to pay. So please reach out, please come in, make an appointment, or show up as a walk-in anytime. Getting tested and knowing your status is so important. Oh, thank you, Paul. Yes, that is the photo that accompanied the article on the front page of the Post and Courier. I want to also, I forgot to mention that there prior to World AIDS Day, there was an AIDS Memorial Quilt event on November the 17th. The Ryan White Wellness Center, which Meredith, I know it's been rebranded and now it's the Roper St. Francis Health Services Center, I think. Is that right?
It is right. They still use the Ryan White as well, but there's a lot of rebranding kind of going on, and it's all the same thing. It's just we're just changing some wording, but
yeah,
yes, that's right.
Okay, thank you. So they sponsored it, and our Tri-County Shape helped to get the word out. But several quilt squares were made here in the Charleston area that will be added to the AIDS Memorial Quilt. That is, I'm pretty sure it's the largest quilt in the world at this point. And one of those panels was displayed at the observance. So that was World AIDS Day. Moving on to respiratory viruses. I think the topic that continues to come up this time of year, every year. We are in widespread flu activity and have been for several weeks. That is our highest level at DHEC as far as our surveillance. Every Wednesday is when we put out information about the week before. We are beginning to see an increase in hospitalizations, both in children and adults, but it's really those physician visits and in emergency department visits for influenza-like illness that have most shot up. We have seen, I think, 5 deaths so far this year. Those have, by and large, been in those ages 65 and over. And again, it's a pretty sharp rise at this point in flu in our area. So if you've not gotten your flu vaccine, now is the time. It takes about 2 weeks to be effective. That's right. We're currently in the middle of the holidays, but that's really getting to be the time that will be around family, perhaps those who are at increased risk, including young children, older adults, and those with other chronic medical conditions. So please get your flu shot, stay home from work if you're ill, and cover your cough, practice good hand hygiene. We're also continuing to see RSV and COVID. So at MUSC, for instance, in the past week, COVID hospitalizations have increased 18%, flu hospitalizations 56%. And we may be plateauing with the RSV. Those hospitalizations began to go down. But we do have the COVID booster. This is a great time to do that. And you can do it along with getting your flu booster, the variety of pharmacies as well as your provider's clinic. And there's also now this year an RSV vaccine for those older adults as well as infants. So please talk to your provider about that option as well. I think I will stop there and see if there are any questions.
Any questions for Dr. Richardson? Dr. Richardson, are you seeing that that mostly you can walk right into a pharmacy and get those shots without any, without any problems, to be able to walk right in and get those quickly?
I have not heard of any concerns. I've certainly heard of more people deciding that now is the time while we're in the midst of the holiday season and flu rates are rising. You can make appointments online for many of the pharmacies and certainly with your provider. But I've not heard of any delays, the RSV vaccine, there has been a few hiccups because it's new. And so getting it out, there may be some more difficulties there, but that's really for the adults. That's really a decision between you and your provider. The COVID booster and the flu vaccine, that's a across the board recommendation for everyone to get those two. So certainly your provider can help you to find the RSV vaccine if it's determined that that's the right thing for you.
Okay, great. Thank you. Joey Current.
Hey, Dr. Richardson. I know that I've at least heard folks have some confusion, maybe thinking that they've already gotten the COVID booster or a couple of boosters. Can you just clarify again that booster recommendation for folks?
Absolutely. So there's a new monovalent booster that came out, I believe it was September, but it was this fall. And so anyone that had a booster prior to that needs another booster at this time. It is the vaccine that's most closely matched with the current circulating variants. And so we don't know for sure yet, but we believe that it will likely be sort of a yearly booster similar to the flu vaccine. So anyone who's not gotten their COVID vaccine since September, this would be the time to get that. Similar to flu, you may have gotten a flu vaccine last fall or last winter. Now is the time because, again, that vaccine also is specially formulated each year to be the best match possible to the current circulating strains.
All right. Well, thank you very much, Dr. Katie Richardson with South Carolina DHEC, and I don't see any other hands up or any other questions. So thank you very much for that report. We'll move on to our health and wellness updates. I guess if you'll just wave at me if you have an update from where, so I don't put anybody on the spot. So Jennifer Brush, if you would, please.
Yeah, good morning, everyone. And I just want to tell you, it's ugly sweater day. That's why I'm dressed like this. So we have an event here. Just wanted you to know I don't usually choose this kind of work, clothes for work. But yeah, I do have an update. 988's been going since June, and we've taken about 3,000 calls for 988. But there is a veterans line on the 988 also, as I think I've mentioned before. We actually have our first site visit today from the 988 folks. We're still about a week out or 2 weeks out to moving to our new call center across the street, but we're very close. And I just had some other numbers to share with you. We just crunched a bunch of numbers for FY23, so you kind of know what we're doing. But we basically served a little over 9,000 people in fiscal year 23. We pay for hospital beds for indigent patients for our local hospitals. We get funding from our own reserves and some from the General Assembly to pay for hospital beds for people who are uninsured. And last year we paid for 2,440 beds to help hospitals pay. It was 303 admissions in Charleston and Dorchester counties. We took in our mobile crisis statewide call center, we took almost 30,000 calls. Of those, a little over 8,000 were actually crisis calls. And here in Charleston and Dorchester counties, most of them in Charleston, we had about 1,300 mobile crisis responses in the community. And that means almost 1,200 diversions from hospitals, emergency departments, and jails. So here in our center, we really go out on about 3.6 mobile crisis calls every single day. We're still the busiest mobile crisis team in the state. And it's not really that we have more crises probably than the other 45 or 44 counties. But we just have such a long-term relationship here in Charleston and Dorchester. We've got staff embedded in all the police departments and things, and we've actually had mobile crisis since 1987. So people know us well, and that's a good thing. Over half of I think about 64% of our mobile crisis calls are actually initiated by first responders, which is good because of all the training we do with them. They know that we're here to help, and when they see someone that they know needs treatment instead of jail, they do call us and we go. And so that's a good thing. We're very busy. We served over 3,000 kids last year, provided over 35,000 services to kids, and provided those services in 103 schools. So I know y'all have heard me cry about our staffing problems for several years, and we still have them, but we're still very busy and we're still serving our community as well as we can. So if anybody has any issues, questions, or anything, you know how to reach me if you ever need anything. But I just wanted to share that. We participated in the Charleston Christmas Parade last week. We're doing Somerville Christmas Parade this weekend. Have our patient party next week with NAMI, so it's a busy time, I'm sure, just like all of you. And they make me dress in ugly sweaters to come to work. So fun times, but that's my report for us.
Great. Thank you so much. Any questions there for Jennifer Brush?
Kevin, just one. I'd like to add to your report the wonderful opportunity you give our low country every year with this mental health conference that you hold with the Gilead. That also adds to these numbers that you just talked about. So we thank you for bringing that to our city.
Yeah, thank you. Appreciate that. Just a curious question, I guess. If someone calls 988, they didn't push the 1, but they are a veteran, do you keep that call? Do you work with the VA at that point, or how does that go?
Probably we'd keep the call, and then maybe if we figure out it's a veteran, we probably would have the veterans line follow up with them. But I'd have to check on that, how we've handled it. because I guess it would take a little bit to figure that part out. And then if we didn't figure it out, then obviously we keep the call. But all calls are followed up in 988 anyway. So my hope would be, and I will check, that we would get the veterans line to be the follow-up for that caller.
Okay, thank you. All right, any other community health updates? Joey Current, please.
Thank you, Councilman Shealy. I always just like to remind folks of this because you never know who is watching these calls and doesn't know about it yet. But, another number for people to remember is that there is, if you need support services and resources from any of our other wonderful nonprofits across the region, folks can call 211 and they can get connected to, supports for anything from food, housing, to any other of those basic needs. So just another number for folks who are out there watching to remember. And that's my update for today.
Great. Any questions for Joey?
Now, I'll just add that, Joey, the reason why we get 30,000 calls is because we're often going into the 211 area and reaching out to you guys, because that is why a lot of our people are calling.
Well,
So
we're
really
happy to
glad
support.
have you there. And I remind people all the time, keep your stuff updated in 211
Yep.
statewide, because nobody can help with that if everyone doesn't remember to let 211 know that they've got a change in services or an addition or something else.
That's right. We're all in it together.
All right, great. Thank you for all you do, Joey. Thank you so much. Anybody else? I know it's a busy, I said I wouldn't put anybody on the spot, but I know it's a busy time for you, Nick Osborne. Is there any way that the city of Charleston can help the Low Country Food Bank this season?
No, thanks very much indeed, Councilman Shealy. Yeah, no, as you say, it's a very busy time of year. Well, it's been a busy time of year all through the year, but certainly as we get into the holiday season. So November was an incredibly busy time as well, not least with Thanksgiving and the holiday season. So we're fully ramped up at the moment. Just to give us sort of a bit of a sense of what we're doing at the moment in terms of support to our community. In November, we distributed over £1 million of food through our agencies here in just the Charleston County. Across all of our counties we serve, that's £3.5 million of food. As we go into December, we'll be distributing again about £1 million of food here just in the Charleston County. So again, similar to Joey said, if anyone knows of anyone that needs support, go to the website lowcountryfoodbank.org, and there is easy to navigate around there and click on find food, and that will give a lot of information in terms of the nearest location of food pantries, also the distributions that are being done, the mobile distributions, the fresh for alls, etc., that are being done during the holiday season. So just encourage everyone to use that resource in a similar way that Joey mentioned as well. But no, busy time of year, and we're doing the best we can to meet that need.
Great. Thank you so much, Nick. Appreciate all that the Low Country Food Bank and you do for our community. Thank you. We know how important it is. Any questions for Nick while we have him? Okay. Anyone else as far as Mayor Tecklenburg?
Thank you, Mr. Chairman, Council Member. I just thought I would share a little update we had last night at City Council regarding domestic violence, which is related to mental health and public safety. Here we are approaching the holidays, and as Nick just said, it becomes a busier time for the Low Country Food Bank, and it seems a little counterintuitive because you're getting together for the holidays. It should be a joyful time of year and all like that, but actually incidents of domestic violence go up appreciably in the month of December. People are, I guess, stressed out. They spend more time at home with their families, and sadly that can lead to more cases of folks not getting along with their loved ones and having domestic violence. So I think that statistics were crazy. Like 20 instances a minute nationally, 20 a minute, like 10 million a year. But December, it goes up 20-30% over the annual average. So just ask everybody to be mindful of that. See something, say something, encourage people just to chill out and enjoy the holidays and get along. But Mr. Chairman, if I may also, while I'm speaking, just thank everyone for your service on this advisory committee and all that everyone does to help make Charleston a healthier place. I'm not sure of the plans for January, but this is likely my last meeting with y'all as mayor. And it's been a real asset to this city and to me personally, particularly with what happened with the pandemic and COVID, in this last term, that this committee even existed and was able to provide such great support and communication in a time of need. And as we discussed today, issue of suicide or domestic violence or ongoing medical and health needs of our community. That's what this committee is all about. And I just thank you all for your service and being involved. God bless you all.
Yeah, thank you, Mayor Teckenberg, and thank you for your vision and the foresight and, man, the hours of work when you had many other things you could be doing, the many hours of work that you put in to this committee and the commitment you've made to this committee. And, I think I speak for all of us. You've made the city of Charleston healthier. So thank you.
Well, God bless. Thank you.
Joey Current, you had your hand up, I believe.
Yeah, one more thing. Sorry, I forgot to mention on the topic of all of these different needs and services that are out there. We run at Trident United Way something called a poverty simulation. It's a great exercise for folks, anybody on the call, anybody whose staff are interested to take part. And it's about an hour-long simulation where folks go through basically what it is like for families who are struggling to make ends meet. You learn all kinds of things about what services are out there in the community. And we have one coming up on December 8th. So I know that's short notice, but it's on Friday. And we have spots still open. So if anybody out there or anybody's staff out there is interested, I promise you it's a game changer to go through a simulation like that and really put yourselves in the shoes of families who we know are being served by many of the partners that are on this call, and to just experience a little bit of a taste of what it's like to have to navigate many of the services that are out there. So I'll send the info to Paul so he can put it in the follow-up notes for anybody who'd like to register. But that's Friday, December 8th from 9 to 11. It's going to be in North Charleston at Royal Missionary Baptist Church.
Great. Thank you for that, Joey. Anyone else? Anything else for our health and wellness updates or anything for this committee? Paul Wieters.
I just want to, for our January meeting, Adrian Swinton, who is our chief diversity officer, I guess would be her role. I'm trying to think. Anyway, she's going to be speaking to us on health disparities in the city and our numbers, and looking a little bit deeper into what all we've been talking about for these last couple of years. So she will be joining us on our January 3rd meeting. And again, we'll be meeting the first of each Wednesday at 9 o'clock of each month, except for the month of July in 2024. And I'll be sending out a calendar invite in the next week or two.
Great. Thank you, Paul. Well, thank you again for your time. This is an awesome group that we have, and I appreciate your expertise and your time and all that you do to help make the city of Charleston healthier and a better place to live. So appreciate it. Look forward to seeing everybody in January. Wish you a happy Hanukkah, a Merry Christmas, and a Happy New Year. We'll see you next year. Thank you. We are adjourned.
Thank you.
Thank you. Thank you.